Magnifuse is one of the products that I like using, especially in longer type deformity situations or in areas where I do a previous decompression. The benefit certainly that has the mineralized bone fiber, which has many publications at this point showing its clinical efficacy, but it's also contained within an absorbable pouch. One of the things I think that we have continued to notice clinically over the years is that oftentimes bone graft extenders or bone graft products, when we place them on the spine, they often can migrate back up into the muscle and don't necessarily adhere to the spine. The benefit of things like Magnifuse is that we can use this to cover gaps, especially in the dorsal elements, as well as placing the posterolateral gutters, and it's well contained within this absorbable pouch. Ultimately, this allows the bone graft to stay where we place it, which helps to achieve good fusion rates.